We are very grateful to have our presenter tonight. We have Kate Esparza-Guerrero, and she's speaking on the topic of Medicare 101, and she has some really great information to share with us tonight. Thank you so much, Kate.
Yes, thank you, Elizabeth. Gosh, I think this is going to be maybe my third or fourth time doing this. So I'm Kate, and some of you know me as Kathleen from my prior years of when I gave these presentations live at the Marlene's stores in Tacoma and in Federal Way. I live here in West Hill, Kent, and I do see clients, Gig Harbor, Tacoma, the East Side, Covington and Renton and Seattle. So I pretty much, and I don't go too far north past Seattle, but I do also Zoom meetings. So now that things are opening up more, I have been meeting clients face to face at their home as well, or a library. It's whatever's comfortable for people. Just a little bit about myself. I have been a Medicare independent agent for going on 5 years now. And independent means that I don't work for a particular company. There's several, like over 20 private insurance carriers out there. But what us agents or independent brokers are required to do is we all have to be licensed, and we have to certify every year with classes that are in the summer. They call them AHIP classes that we take, and then we have to test and pass. So that's always done in the summer. So I do that every year, and then depending on the companies that I choose to represent, then I do a short certification with that particular company. I had started out just representing 2 companies in the beginning, and then now 3, and I think I'm going to go into 4 companies. I just focus on the Medicare insurance part. There are many brokers out there that if they don't work for a particular insurance company, they're independent, but they also take care of life insurance, or there's property and casualty. I don't do any of that. I just wear one hat, and that's just with Medicare. I definitely love being the independent part of it for my own personal reasons. Family, I have an elderly father who's 93, and then a granddaughter that I help babysit. So I love having this flexibility. And I just turned 65. So after being in a corporate industry and just out there in the work world, I don't want to have anybody else telling me what to do. So this is a great job. If anyone ever was interested, I'd be more than happy to talk to you about it as well. But anyways, let's see and just to let you know, you're probably wondering, well, then how on earth do you get paid? The way that independent brokers or that get paid is from the private insurance carrier. So typically, once you are ready to enroll in a plan, whichever company it is, that company, once you've enrolled, that's the insurance company that's going to pay the broker that would be paying me. The private insurance companies, they pay the same across the board, so that then there isn't any bias that would be on that broker's part of like, oh, I only want to enroll people, cherry picking. I only want to enroll people in this particular company because I get paid this much. That doesn't happen in the field of, the competition. It pretty much, when it comes down to me helping people select, it is very unique depending on what your own personal needs are. And that's where I put the time in with you on getting your doctors and medications and finding out what you really need. Okay, so first things first, let's just first talk about eligibility for Medicare. And the Medicare, here it is, really familiar for some of you. For some of you that are planning, that a lot of baby boomers, such as myself, have been doing. I get many calls from people that I'm getting ready to retire in a year. I need to know what to do. Well, eligibility and what makes you eligible for Medicare. The 65 years old, or if you are under 65, but you have a certain disability or there's a special situation that you can qualify for Medicare under 65. You have to be a US citizen or a legal resident for 5 years, consecutive 5 years. I like to help you. There's a lot of terms out there, supplemental insurance, gap insurance, Medicare Advantage insurance. The initial, what you have to have is, this is the federal, just remember red, white, and blue is federal. And that is what everyone is going to be eligible for that has worked 40 quarters, or it's like an average of equivalent of 10 years where you have paid your where you have paid out of your paycheck, payroll to your Medicare, and then you are eligible for your Medicare Part A for free or zero premium. There wouldn't be any premium. Now, there are some people that have to pay, or they can have the Part A. They're going to be eligible for it, but they have to pay a premium. And that part, I'm not sure on how many months you would have to work to be eligible, but there is a premium that can go from $208 up to like 500 something. It's either one or the other, depending on the number of quarters that you have worked. But honestly, I haven't had anyone in the past 5 years that has had that situation. Everyone has qualified just through their years of work or disability for the federal Medicare program. Okay, so what does that entail? Well, you have your part, you're also, what's unique is it used to be our Social Security numbers that were put on our Medicare card. As of about 3 years ago, that changed to a unique Medicare identification beneficiary number. And everyone should have that now. People that had their old Medicare cards have tossed them because they've all been mailed a new card. Now, the Part A. The Part A, that is your hospital, and meaning that's inpatient care. And it's skilled nursing, hospice, home health services. And with that Part A, there is a deductible. That deductible is what you have to pay first before the Medicare pays for the services that occur while you are in the hospital. Now, the premium or the deductible is for a benefit period. So it's like once a physician has admitted you into inpatient. Now, mind you, sometimes you can be you're admitted into the ER and then you're assigned a room, but you're still classified as an outpatient because there has not been a definite diagnosis yet. So that has happened. People have questioned some billing where they're just like, well, I know I had a room, or I knew my spouse was in a room, before 2 days. So why is it still an outpatient coding? That's why it's until a diagnosis occurs. So once you have been admitted by a physician into inpatient, then that's where the inpatient costs would incur. Okay. And there's the benefit period. So let's say you have appendicitis and it ruptures and you're admitted, and there's an infection. So you have to stay in the hospital for 2 or 3 days. Then you go home. And then after another week, that infection flares up again. You have to be admitted again. Since you were admitted again within 60 days, you do not have to pay another deductible. But if it's past the 60 days and you're admitted, that's considered a new benefit period. And then there is that $1,600 deductible. That is for 2023. The deductibles for Part A typically change every year. Okay. Let's see, what else do we know about Part A? That the deductible is 1,600. I don't want to go too far into it yet, because I'm still focusing on original Medicare. Now, Part B, that is the part where that is the medical part that is outside of the hospital. So that's where the majority of us are, maybe even outpatient surgery, physical therapy, occupational therapy, your primary care doctor. Sorry, that's my husband calling me. He knows I'm in a meeting. So anyways, what I needed to get back to is, so the Part B is that you also, it's everything else. So it's like your primary care office visits, your physicals, everything that is outside of the hospital comes under Part B. And that is where you're going to be paying a monthly premium. And some of you know, or maybe you've heard friends talk about this Part B premium, where this year for 2023, it actually went down. In 2022, it was $170.10. For 2023, it went down to $164.90. So we were very happy about that, because also Social Security benefits went up for 2023. So it was a good thing. Anyways, that changes every year, just as I went over. So the Part B is where you're going to be paying a premium, and it is the same. That's the standard. That $164.90. You can actually go online and check through Medicare.gov, and there is a graph, a table, where it will show you an income and then where you would fall in the bracket of how much that premium would be. So I believe it's $186,000 for a family, a couple that's filed taxes. It looks at the gross adjusted amount, and they go back 2 years, mind you. That sometimes catches people off guard, especially if they've been paid bonuses, if they retired early. Their income isn't going to be what it was 2 years ago. You can file to have that reviewed and to have that premium brought down. The premium goes up to, from the $164.90, I believe it goes up to 200 something is the next level. But again, the majority of my clients are in the standard premium amount. So that's for Part B. Part B also has a deductible, but that deductible is just once a year. Once you've satisfied that deductible for Part B, and that deductible is $226. Okay. So what did we cover? The original Medicare is federally funded by you paying into it for 10 years or 40 quarters worth. You are eligible for that Part A of no charge. There are many people, especially baby boomers, that reach 65, but they're still choosing to work. So I've had people say, hey, Kate, do I still need to enroll? You don't need to, but why not? Why not have your Part A at least, so that if you were hospitalized, you would have your employer group coverage and your Medicare, and then you would be paying the third. So Medicare, the way Medicare works is Medicare, with your employer group coverage would pay first, then Medicare's in the back seat. So let's say your employer group coverage paid 80%, then that 20% Medicare Part A would cover, and then Medicare Part A pays 80% of that 20%, then you would pay the remainder, which that is correct. Original Medicare pays 80% of the Part A and Part B, and then you are responsible for the 20%. So going back to the person that is turning 65 and still working, yes, enroll, go ahead and have Part A because you've paid for it, you're eligible for it, so why not? So then once that person who has been maybe working for a couple of years, now they're 68, they're like, I'm done. I'm getting ready to really, retire. So then there's paperwork. Not a lot, but it's important to really know when you're going to retire. You can't be wishy-washy about when, I think maybe next month, because you want to get that paperwork into your employer. They need to fill it out. They need to give it back to you. Then you have a form and you mail those 2 forms to Social Security. Then Social Security does their part, finds you in the data system, then mails you a new card where it'll show Part A, which would have the date of when you had turned 65. And then the Part B would be a different date because it would be correlated with the year of when you are retiring. Also, keep in mind, it's the first of the month. Doesn't matter. Like I've had some people saying, I have medical coverage through the middle of the month. Can I have my Medicare begin then? No. Medicare only begins, and also private insurance companies, the effective date is always on the first of the following month after you have enrolled. Okay. I think I've covered, let's see, I'm going back looking over my notes to make sure I don't leave anything out. Oh, yes, your original Medicare is just the hospital and the medical, no prescription drug coverage. So please remember, if you do not have employer group coverage and you are just going to have original Medicare, Part A and Part B, you need to get a private drug plan, PDP, prescription drug plan. If you do not have a prescription drug plan, after I think it's 62 or 63 days, you will start to accrue a penalty for the number of months that you go without a drug plan. That's where I get a lot of calls from people where they're getting misinformation and there's a lot of fear of like, oh no, I don't want to get a penalty. If you have employer group coverage, you do not have to get a drug plan because your medical is covering all of that, your prescription and your medical. It's once you are without your employer group coverage where you're not going to be getting that prescription drug and you are then going to have Part B enacted on your original Medicare, you need to get a private drug plan. Or this is where we go into, you can have a supplemental plan or a Medicare Advantage plan. And that's where our private insurance companies come into play. But before I jump into that, I want to just go over the enrollment periods. Those are important to know as people that maybe you're getting ready to turn 65, maybe in June or next month. So there's a 7-month window of when you can enroll in Medicare, and you're not working and you want to start getting your Medicare benefits because you're going to turn 65. You don't have any employer group coverage, and COBRA, mind you, does not count. It is not credible coverage, so you can't count that. So 3 months before the first of your birthday, and then the month of your birthday, and 3 months after your birthday. Those are the 7 months that you are eligible to enroll for your original Medicare. Most people typically enroll before their birthday month because they want it to begin their birthday month. Like my birthday was October, and so I went ahead and enrolled in September. I literally waited till the very end of September. Um, anyways, I got my card and it said October 1st, 2022. So, and then if I didn't do it at that time, I could have also enrolled in November or December or January. Once you do that, though, then remember it's going to be, you're going to be eligible the effective date the first of the following month. So you want to pay attention to if you're going to need to have that medical coverage to start on the month of your birthday. Okay. So that's called the initial enrollment period. The next is the annual enrollment period. And that's the one where you get inundated by tons of commercials and then mail coming in. It's just horrible. I've actually gone to some people's houses and they bring out a box of mail. By the time I leave, they maybe have 1 or 2 envelopes. We've tossed everything else. That annual enrollment begins on October 15th and ends on December 7th. Who's eligible for annual enrollment? People that are already enrolled in original Medicare are eligible to change a plan. Like if there is a person that just has original Medicare and a separate prescription drug plan, this is the time period that they can enroll in a supplemental plan or a Medicare Advantage plan. That supplemental plan, they will also need to have a prescription drug plan with it. But that's the time when they can change. People that are on Medicare Advantage plans can switch to a different Medicare Advantage plan. People that are on supplemental plans can switch to a different supplemental plan or a different Medicare Advantage plan. And you can change plans as many times as you want. Most people, once I've done a change with them, they don't typically make another change. But it was kind of like a saying, last man standing, meaning if you changed your plan 3 or 4 times within that time period from October 15th through December 7th, the last plan that you had enrolled in by December 7th, that's the plan that's going to go into effect on January 1st of that new year. So that's annual enrollment, AEP. Open enrollment, which can be very confusing because that's also a term used where employers are changing different insurance plans. But for Medicare, open enrollment is from January 1st through March 31st. And open enrollment is for people that are enrolled in a Medicare Advantage plan that want to switch to a different Medicare Advantage plan. Maybe they made an error, or the plan that they enrolled in during annual enrollment, let's say after a month, their primary care doctor has left, and they need a new primary care doctor, and they want to go with a different insurance plan. Then that's the time to change. If someone is on a supplemental plan and they want to go into a Medicare Advantage plan, they can do that as well. But it's mostly Medicare Advantage. The open enrollment period is really just geared for people that are Medicare Advantage plans. You can also get off a Medicare Advantage plan and just go on to original Medicare. I had one client that had to do that. I won't go into details for it, but it literally came down so that they could be able to have a coupon for a particular prescription that was going to be as much as $3,000 a month. So there's a lot of different cases out there, again, that's my job on helping people weed their way through. Okay, so we did the initial and annual and open enrollment. Now, the last special enrollment is any time during the year that you can change your plan. Well, how can I do that? If you move, If the county that you're living in, the insurance carrier pulls out. And then certain health conditions, like if you end up being diagnosed with a chronic condition, that can qualify you, and or retire. That's actually a special enrollment period. So you don't have to wait till a certain time period to retire. You can retire anytime during the year and you would qualify for a special enrollment period. So if you have a Medicare card, Plan A, you're working, and now you want to enroll into a supplemental plan or Medicare Advantage plan, you would be eligible. We would call that an SEP. And then also there's people that sometimes for financial reasons, their income has qualified them for Medicaid. Then there are special programs that they would be eligible for, and that can be any time during the year. Okay, so those are the enrollment periods. Let's see, I went and talked about the open enrollment. Now, this is the last part. It's about the private insurance plans. So the private insurance carriers, they're the ones that will help you with that 20% that Medicare doesn't cover. Okay, so the supplement plan is sometimes you heard it called a gap plan, a Medigap plan. And then these plans, let's see, sorry, my husband's calling again. I'm sure everything's okay, but I am just going to text him. I'm in a Zoom meeting. Okay. Medicare. So with the supplement plan, Medicare pays first, then the insurance plan, whichever carrier that supplement plan would be, would pay, and then you would pay the remaining. So the supplement plan will cover the parts that the original Medicare doesn't cover, like the deductible. The supplemental plan will take care of that. You don't pay any deductible. The original Medicare, you do have to get a separate drug plan. Supplement plan premiums can tend to be a little more expensive because there aren't any co-pays, and there isn't any co-insurance, and meaning also that there isn't a network where you have to go to a doctor in a network. You can go to any doctor you care to, as long as that doctor accepts Medicare. So that's the main reason that people have chosen supplemental plans. But honestly, I have more people that have opted to go with Medicare Advantage plans. So what are Medicare Advantage plans? Well, Medicare Advantage plans, they have the drug plan wrapped, bundled up with your hospital and medical. So, and Medicare pays the insurance company a fixed rate. Then the insurance company directly pays the doctor or the hospital, and then you pay the rest, you pay the remainder. Network, the word network. Well, I grew up here in the Pacific Northwest. Some of us know group health, as Kaiser used to be group health. And at that time, when I was growing up, that was the only medical facility that required that you had to stay within that network. Now, the majority of our hospitals and doctors are in what we call a network. University of Washington, CHI, St. Francis, Virginia Mason, Valley General. They're all, I have found that when I am looking up doctors and specialists for clients, that if I'm looking, let's say, if I'm looking for one private insurance carrier and it's maybe one of the top three, I look at the other insurance carrier. Yep, that hospital and those doctors are in that network as well. It usually, when people are shopping for a Medicare Advantage plan, it's typically the extras that have people picking a particular Medicare Advantage plan, such as a lot of my Marlene's clients are very particular about wanting to have a naturopath or a massage therapist or a chiropractor. And there are some insurance companies out there that lean towards where they have a larger network, or it's easier to get a naturopath. And then there's dental. This is my soapbox time. My daughter is a dentist, and so I learned a lot from her that the first word of advice I have for anyone that's getting ready, if you haven't retired yet and you have employer group medical and dental coverage, please get as much dental work as you can get done before you retire and lose your employer group coverage. Because honestly, I can say without any argument here from anyone that, or amongst my colleagues, there isn't any plan, private Medicare Advantage plan out there that has this amazing dental. They do have dental. Medicare Advantage plans do have dental. Some of them have as much as $1,500 or $2,000 a year that you can use towards getting your teeth cleaned or any work done on your teeth. But sometimes that dentist has to be in that insurance carrier's network. The insurance carriers are getting better now about maybe the patient pays up front and then the insurance carrier reimburses the client. So we have different plans within the carriers, which is, again, that's where my part comes in, where I do the homework, finding which dentist in which area. I even keep a spreadsheet where I have clients that get back to me like, hey, this dentist in Tacoma was great, and they take this particular carrier. So that is very important to remember. So the Medicare Advantage plans, they have, vision, and the supplemental plans, they don't have as extensive of the extras. Silver sneakers now has become popular again. For a while, it wasn't that big of a deal for while we were in COVID. But now it's gaining popularity. People are really excited about that because you have free membership. You don't have to pay that $26 to $31 a month. If there is a gym that you like that isn't in that carrier's network, there is a process that you can go to get them added, depending on the carrier. So let's see what else. Oh, yes. And Medicare Advantage plans have co-pays. And so that's part of the network. So you've got the network, we call it like HMOs, right? And then there are co-pays. And the co-pays can be maybe depending on the plan. Maybe to see primary care, it's $0 copay. And to see a specialist, $35 copay. And how much is the monthly premium you're having to pay for that plan? There are plans out there for $0 per month. They go from 0 to maybe 35 up to $88 a month. It depends on what your premium is, on what your co-pays are going to be. And then last but not least, we have maximum out of pocket, MOOP. And maximum out of pocket means that those co-pays will typically not add up to that amount, like a maximum amount. It's not a deductible. It's what you're paying out of pocket. And once it meets a certain amount, then the insurance carrier pays the rest. Okay. And that maximum out of pocket has a level that the insurance carriers are not allowed to go above. And that's one thing with Medicare, the original Medicare, 80%, and then you pay 20%. There is no limit. There is no ceiling. So that is why you are going to want to get the private insurance carrier, whether it's the supplemental or the Medicare Advantage plan, to take care of that 20%. Okay. I think I don't want to overload you, and I'm checking my timer. Okay. I'm about at 35 minutes. I'm happy. I didn't want to go over 30 because there's just a lot. I know there is. And typically when I meet with people, sometimes we're together for an hour and a half, and then I send you home with some, maybe a couple of the insurance carrier books to look at. And people typically, they're home and they talk to their spouse, or they just want to do a little more research on themselves. And then the following time that we meet up for enrollment is quick, like maybe 15-20 minutes. I can do the enrollment on my iPad electronically, and it's just short and sweet, and you don't pay anything up front. Again, if you enroll in a Medicare Advantage plan with a 0 premium or a $35 premium, you get to set up how you want that to be paid, whether it comes out of your Social Security, whether you have a coupon payment book. You get to choose. Same with the supplemental plan. It's pretty much the same way. Some supplemental plans require that you have a payment go with your enrollment, and there are some companies that don't require that. So I think that's it. And I don't know, is there time for questions, or
Oh,
do
yes, we definitely have time for questions. And how can people reach you to schedule? I did enter it in the chat box, but just for the
oh good.
recording sake.
Yeah, here's my card, and I will also my phone, and Elizabeth will send that. My phone number is 253-216-8823. And please, you can text on that number as well. Sometimes I'll see the text sooner. I have my business line on my personal phone, so I always see it, and I tend to notice there's like a little red dot that comes up. I'm like, oh, I've got a text, and then I can read it right away. But you are more than welcome to call and leave a message as well.
Perfect. Thank you so much, Kate. I think
You and
I think we'll stop the recording and that way open it up for questions.